for another episode of the Geopolitical View. And today we have one of the top plastic surgeons in the world, Dr. Michelle Zweifler. Thank you so much for joining the show.
Thanks for having me.
Yes, so I'm going to jump right in because we have so much to sort of talk about and unpack. But my first question for you is, can you share your background and your journey towards becoming a plastic surgeon?
Of course. Well,
double board certified plastic surgeon.
The general surgery and the plastic surgery.
The reason why I invited you to join the show is because the BBL, which is the Brazilian butt lift,
yes,
right, has become a very popular surgery, but there's so many risks involved, and I just want to make sure that I'm using my platform in a way that educates people so they make the best decisions for themselves and their bodies and their families.
Everyone needs medical clearance, by a board certified internist or family medicine doctor beforehand. So I want to make sure that your heart's in good shape, and that if you have diabetes, that's controlled. And sometimes some of those diseases are harder to manage in certain ethnic groups. So you really want to make sure. I've had patients who have postponed surgery because their blood pressure was sky high or their weight was too high. We want a safe BMI. We don't, not everyone's body is built the same way, and we don't all have to be super skinny, but we want to limit complications. We want to make sure that you're in the best health. And I've had patients that have lost a lot of weight before surgery because we want to optimize the results. And especially for a BBL, that you want patients to be well hydrated. You're removing fat and doing a lot of liposuction in one part of your body. So with liposuction, you want to make sure that you're well hydrated, and that that those areas are going to look good that you remove the fat from, and that you're putting the fat in to the butt. And you want to make sure that, patients are doing it also for the right reasons. You don't have plastic surgery to get a guy or to get a job. You're getting it for yourself. You want to feel good for yourself. There's no guarantees that is going to change. I will say, when it comes to my patients that are African-American, I do go over scarring in great detail because there's a higher incidence of keloids and darker complexions, being it Asian, Hispanic, Black, all different subtypes. People do have a higher incidence of keloids. And I want people to know, I want to know what their history is for healing and their family's history for healing. Are their scars darker or lighter? And with a BBL, the scars are pretty small, but you still don't want a bad keloid that's painful or unsightly after anything that we do. And that, again, is part of our discussion.
Okay. And so as we discussed before we started the show, I was very surprised to see that the BBL surgery has the highest mortality rate of any other plastic surgery. Can you sort of explain why, what's the cause of that? Is it
a part of it
patient education, or is it something more?
It's a couple of different things. I know we want to talk about medical tourism. Part of the problems even happen, there's been a lot of incidents, unfortunately, of death in Miami, in the United States. And that's really, upsetting. But what we've learned, through our society meetings, both the American Society of Plastic Surgeons, as well as the Aesthetic Society, where not only you need to be board certified, but you need to meet peer review to get into these organizations. So you'd like to make sure your doctors are part of these societies as well as board certification. What we learned is that a lot of the BBL issues are that when the fat is being injected, instead of injecting it into the fat, it's getting into blood vessels that are coming from the gluteal or butt area and going basically through the either vena cava to the heart and lungs, and that's what's causing the fatalities. So our societies have decided that you can't put fat in the muscle. It could only go, fat needs to go in the fat. Okay. And you have to limit, part of it's technical. Who's performing the procedure? Is it the board certified plastic surgeon? Is it someone that doesn't have credentials? Are they having an assistant do it? I mean, some of these chop shops, when the cost is so low, you don't know what's going on. Florida has now mandated that when you do BBL, that you use a special device so you could see the depth that's going in, because we all have skin.
Okay.
Underneath we have fat, there's muscle, and then there's structures we don't want to be in. And so with this little handheld device that could go in a sterile bag that hooks up to your iPhone or iPad, you could be watching and assessing the depth. This is an ultrasound, a sonogram like you get when you go to the radiologist, and it's done to make it more accurate, to minimize complications. Also, besides accredited doctors, ultrasounds, and everything, they're kind of limiting the number of procedures done in a day. Some of these places that the prices are too low, or as Crazy Eddie used to say, the prices are insane. They're doing 6, 7, 8 cases a day, and there's some fatigue, whoever's performing the procedures, and fatigue could cause some of the problems, and so they're trying to limit 3 BBLs per surgeon a day to try to minimize fatigue or the human part of it. Because as physicians, we want to help our patients. We don't want harm. No one wants death or complications.
So is that a law? Is that a requirement? Or like, so someone asks the question, like, how many other surgeries, BBL surgeries, do you have today?
Are you doing a day? I mean, liposuction, I love liposuction. For me, it's like a win-win. The patient looks good, and I get a workout. There is labor involved on the surgeon's end to do liposuction.
Okay.
There is, in case if anyone's seen any videos on it, it is somewhat of a manual procedure, and using certain devices like Vaser, which ultrasound kind of melts the fat a little bit, and power assisted liposuction, that it minimizes some of the labor intensity on the surgeon, but it is a physical procedure. So we want to minimize human error. And by knowing, am I going to be, my surgery starting at 8 p.m. and I'm case number 8, that is not a good sign. And no matter really what the procedure is, sometimes surgery starts later because you have a later starting time, but you want to make sure your doctor's well rested and ready to take care of you, because, we do have responsibilities to our patients.
Okay. And what about the mental health aspects of things? But
as far as routinely sending patients to psychiatrists, no, I don't routinely send patients to psychiatrists. We really try, and that's why I try to speak to patients and get a feeling for them. Are they going to be happy? Are they a good candidate from a mental aspect? And we do discuss mental health. Do you take any antidepressants, anti-anxiolytics? Is that controlled? Some patients are very forthcoming. In New York State, before you could write any prescriptions for controlled substances, we have to check online so we know what medications patients are on. But we want to make sure people are in good mental status. And if there are concerns, yes, they do get referred to a psychiatrist or psychologist.
And do you know of any procedures that one can take to get a similar result to a tummy tuck?
Component of what we do, especially for, abdominal procedures. Then there's the, non-surgical, what works for skin tightening, what doesn't work. Cool sculpting, helps. There's like a 20% fat reduction. It's non-surgical. It may need to be repeated. If people have a lot of extra skin, that's not going to work.
Okay.
Sculpting helps tighten the muscle, and it works. I've tried sculpting. You definitely feel your rectus muscles getting tighter, and it makes me work out more efficiently if I go to the gym. But that's something that's a series that needs to be repeated. I don't have a 6-pack from doing Sculpt. And then Sculpt has an Sculpt Neo that has some radio frequency, and there's other devices that have radio frequency. It's supposed to heat up the fat. And cold sculpting freezes the fat. And in both of those cases, the goal is to kill fat cells, to shrink the thickness of fat. So you're not going from fat to zero. You always need a little fat on the skin, because muscle and skin shouldn't be touching. You need some little fat or a little cushion on it. Otherwise, you're going to have sagging and contour abnormalities. So some of these devices work. They tend to work better in people closer to their ideal body weight or BMI. The non-surgical stuff is good. There are limitations. It may require a bunch of treatments to get your results. And even then, it might not give the same results as liposuction, but overall, there's a lot less risk, and everything goes down to that. It goes down to risk, benefits, and being educated.
Okay. And I want to ask you a question about EM scope, because that's what you mentioned, right? It seems to be the next, like the big fad, right? Where the celebrities are walking around with these scope stomachs and the arms. And so you're saying there, in some cases, if you're near your ideal weight, right, then you may be a good candidate for that.
It works the best because you could see, in order to see muscle definition, you can't have much fat on the muscle. I mean, you could be in good shape at the gym and you can lift weights, but if you have, a couple inches of fat over it, you're not going to see that muscle definition. And as abs are made in the kitchen, yes, we do have to eat healthy. Like, it all complements and goes together.
I have a question for you about Botox.
It lasts, about 3 to 4 months. Some people want to be frozen. Some people want to be animated. And, people frown. People like sometimes concentrate and they frown and they don't like these 11 lines. And if you have them for too long, they could get a little bit etched in. Crow's feet, some people think it looks cute, the little crow's feet, and other people like, I don't want any crow's feet. But it also does shape,
here, guys, in the eyes,
the side of the eyes.
Young, by the way, guys. So who is not a good candidate for Botox? Who's not a good candidate for the EM scoping? Because I've read somewhere that if someone has an IUD, that can be sort of like, and I guess this is the importance of going to a doctor, because someone may not know, right? That's maybe had training for, a day or two. They may not know all of the nuances of how these electromagnetic, is that what it is? Like,
well, that's it. That's the whole problem, is that you need to always take a medical history. The same thing when you go into an MRI machine, you can't have certain metals, and the same thing applies for M sculpting. It's not. And if someone has a pacemaker, you don't want to have M sculpting if you have a pacemaker either.
No,
I guess IUD is probably more common, but you got to think about
the copper IUDs.
Yeah.
The copper IUD, because it's somewhat metal, right?
Yeah.
So no copper IUDs. Okay, folks. If you're looking to get that stomach slim down, if you have that copper IUD, you may have to rethink that decision.
And with Botox, people that have myasthenia gravis and have been on some recent aminoglycoside antibiotics, those would be contraindications. But if you have too many wrinkles, it's probably not going to get rid of the wrinkles. And if you have tons of wrinkles up here, it's not going to get rid of everything. There are some limitations.
So you start early.
We're not doing Botox.
What? Do you start early before the wrinkles?
I mean, I don't know if I believe in preventive Botox. My other thing was, you're not going to start giving Botox to kids in high school either. You don't want to wait till too old, and you don't go too young. But you want, some wrinkles will be etched in, and people have to realize what could be treated and what could be addressed. And sometimes some of the wrinkles on the side of the crow's feet area are actually because your cheeks used to be up here. So there's a loss of volume, not just animation or expressive wrinkles. Botox treats expressive lines, lines that are from gravity or sagging, like the nasolabial fold here. This is not Botox. This is more filler. This is gravity, that the cheeks were higher and they came down. You want to make sure your products are FDA approved, and that your doctor's buying them from the manufacturer and not, buying it on the internet either. Now,
I have a question for you in terms of folks that are traveling outside of the country for plastic surgery. If someone wanted to make this journey, like first of all, do you recommend that? Okay.
I'm all about patient safety, and there are places all over the world. There's, like, Turkey's now a hot spot. Brazil's been. The Dominican Republic's been a hot spot, and there are some places where these surgeons are trained in the United States or at their top hospitals in their respective countries, and they meet the standards. You want to make sure the anesthesiologist is a board-certified, credentialed anesthesiologist. You want to make sure the surgeon is expertise in their fields. And so for our societies, both the ASPS, the American Society of Plastic Surgeons, and the Aesthetic Society, we have international members. So those, if you want to go abroad, see if your doctor is an international member of our American societies, because that meant that they did appropriate training and got the appropriate recommendations and peer review, and they work at an accredited facility that meets certain standards.
Okay, so that's the international what
Well, that's
society?
another one. We have the American Society of Plastic Surgeons, ASPS.
Okay.
We have the Aesthetic Society.
Okay.
There's also ISAPS. This is International Society of Aesthetic Plastic Surgeons, and that's worldwide.
Okay.
And you want to make sure that, one, you want to know who your doctor is. You're not just going on a hotel trip to stay for 2 weeks at a beautiful resort in the Caribbean or another country. That's the first thing. Don't get lured in by includes your flight, your hotel, a spa treatment. You want to know who is the doctor.
Okay.
Are they a member of these prestigious societies? If they're not, that's a problem. Also, did you meet your doctor beforehand? Or are you just showing up at some clinic and you don't even meet the doctor till the morning of surgery?
Yes. All red flags.
All red flags.
Okay.
But, there are places that are amazing. I mean, the cost of plastic surgery is expensive in the United States. And why is it expensive? Well, rent is expensive. Equipment is expensive. Nursing staff, is expensive. Anesthesia is expensive. And that all goes together. But I know I'm using board certified anesthesiologist. I'm working in an accredited facility. I'm a board certified plastic surgeon. There's expertise and training involved. And it still is a luxury item. And, plastic surgery, going somewhere just because it's cheaper, it's your life. And even if you had a friend that went there and they're fine, you still need to do your due diligence.
Yeah.
And I've heard from patients, because I've seen patients who have had complications or surgery abroad, not speaking the language is a disadvantage, because you cannot communicate. Especially if you're having problems, you can't communicate. And patients post-op sometimes feel more isolated because they don't have an appropriate translator. So if you don't speak the language, travel with someone who speaks the language, so you know that your questions are being answered, especially if you have concerns about fever or too much pain or what was done. You want to make sure things are done safely. And as far as before and after results and pictures of facilities, there's a thing called Photoshop, and you don't know what's real. Have you ever gone on a dating app and find out that that's really not the person you're talking to? They don't look anything like that. Well, this is your body. This is your health. So really be careful. And I'm not saying places aren't good to go. And if you're going somewhere to save money, and I understand that, things are expensive, as I said, do your due diligence. Make sure your local doctors here do your pre-op testing, so you know that you're medically okay, and that you have someone here in the United States. So in case you have a problem, that your internist is on board or that your dermatologist is on board. You want to do it safe. You want to make sure you stay, if you are going abroad in the country, for the appropriate amount of time. And on an airplane, you don't want blood clots, shortness of breath, swelling in a leg.
I was going to ask you that.
Real problems. And, people, get a family history. Find out if anyone in your family gets blood clots. I mean, you need to know what risks are involved. And yes, plastic surgery sometimes could be just getting a manicure, but it's not. It could appear that way, but it's really not. It is surgery. And, and if 10 doctors in the United States say that you're not a candidate, don't go somewhere else to have surgery, because you're still not a candidate.
You're still not a candidate, right? Okay, that's great. And I'm glad that you mentioned that you could get post-op testing done. If you do decide pre-op, I'm sorry.
Yeah, do it in the United States. Make sure you have blessings of your doctor here.
Yeah. Okay. Make sure you have the blessings of your doctor here. They probably won't get the blessing, but right. How long should one wait after surgery before they travel back to the United States? I mean, Dominican Republic is 2.5 hours away, but if they're traveling, far to Brazil, that's That's
Well,
a
yeah. Well, the risk of blood clots actually doesn't just exist from the day of surgery. I mean, before surgery, you have the risk when you're flying down. So, avoid alcohol and drink plenty of water and be well hydrated before
okay.
surgery starts. Find out if your doctor there or your doctors here recommends, like, wearing support stockings on the plane or even certain blood thinning medications to minimize the risk of DVTs. So that's one issue. As
Hmm.
far as post-op,
So wait,
depends.
you're saying in general, just flying, like that creates a risk of
That
blood?
if you just people get blood clots just flying without having surgery. People could fly from the United States to Australia and get a blood clot just from a long flight. Usually there's a family history of it, but it most commonly is associated with dehydration.
Hmm.
Um,
So stay hydrated and just, like,
Move your legs around. You don't want to be in one
okay.
position for too long. But flying itself is a risk for blood clots.
Oh,
Um,
okay.
any immobilization, dehydration, and stasis, staying in one position.
Okay.
But as far as how long you're in the country for, like certain procedures, like a tummy tuck, you may have drains and these tubes connected to a bulb, and drains may come out at a week, they may come out at 10 days, 2 weeks. So you need to kind of find out from the surgeons operating there, I need my drains out. Am I going to be here for 2 weeks? Am I going to be
Mhm.
here? Is it liposuction that I could maybe just go home in a week or a couple of days? It really depends on the procedure. A facelift, 10 days, 14 days. The risk of complication, you usually know if an infection is going to happen within the first 2 weeks, 10 days to 2 weeks.
Okay.
The
Okay.
question
What
is,
are
if you have an
signs of,
infection, do you want to be in the United States or do you want to be in a foreign country? I mean, those are the things you want to know.
yes. Okay. 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 This is great information because again, there are women that are traveling, to a different country for these surgeries, and some unfortunately are not, like, just I see the headlines, and it's just like women in their 30s, 40s, and 50s are dying, in these facilities, and it's just heartbreaking. Where do you see the future of plastic surgery?
Well, going back to machine, in general surgery, there are using more and more surgical robots to do a lot of their procedures, to do parts of the procedure, but it still requires a human working the robot. I
Mm-hmm.
think AI for reading radiology and x-rays and
Okay.
certain scans, we're getting there. Do I think we're going to become obsolete? I don't necessarily think doctors will become obsolete or surgeons will become obsolete, but the companies keep working and trying making better non-surgical, skin tightening devices. I bought my first device last year called SoftWave. It's a non-surgical ultrasound for skin tightening.
Mhm.
Why do I like it? I'm looking at the pictures and I was impressed with the before and afters. Yes, it's not a
Okay.
facelift result, but the necks look good, the jaw lines look good from one treatment, no downtime,
Mm.
all Fitzpatrick skin types. So you could be, 1 to 6, so anyone could have it. And there's no
Mhm.
downtime. It sounds too good to be true. The things that they didn't totally tell me is like, oh, you do it once a year. I think it needs to be done every 6 months.
Okay.
But,
So it needs to be
I
it needs to be repeated. It's not permanent.
no, but
But
it's
no
not a series.
downtime.
It's not a series where you have to do, 4 treatments at once. You
Mhm.
get one treatment, and then if you deem it helps and you want to do more, you could do more. But I do think there'll be improvement in non-surgical skin tightening devices. There's many manufacturers out there. A lot of them come from the United States, Europe, Israel. That there's all over the place making new lasers. Not everything's a laser. Some things are medical devices that are non-lasers. Like ultrasounds and radio frequency. So I think there is a trend to better devices. Yeah, it sounds great. Let's just walk into this room and lose 10 pounds doing nothing. Um,
Look,
um,
it sounds good, right?
it sounds great, but it doesn't work. And you also have to think, like, we are responsible. I do think that saying, I don't know who said it, but you are what you eat does play a role. But I
Mhm.
think technology keeps improving, so the devices will improve. There will be more use of AI. Going back to my ultrasounds, I'm
Right.
going to a training at a conference later this week. I just want to do one shout out. It's a women's ASPS lecture, so for female plastic surgeons.
Okay.
Not discriminating, but I'm just highlighting girl power for a little bit.
Yes.
And I'll learn to use this more, but there are AI capabilities with my handheld ultrasound because I am not a sonographer and I'm not a radiologist.
I
I
love
am
the
I
technology.
am a plastic surgeon and an MD, so I could use a little AI on this.
Yeah, the scientist in me loves the technology. Like, let's keep going. Right? Let's see what we can
Exactly. So
do.
it's exciting in medicine. It really is. I mean, there are right people that are in technology, that are in healthcare, and I look forward to seeing some of the new devices because guess what? I'm not getting any younger and I always want to stay looking relatively good.
Oh my gosh, I have to have my daughter shadow you, right? She's a senior. She's like headed into medical school. They're like, wait, you need to shadow
Awesome.
a doctor. And she's
Awesome.
19, so she's like, so young. But I'd like to thank you for joining the show. This was incredible. I hope all of my listeners gained the tremendous amount of information from you. Again, thank you for joining the show.
Thank you for having me. And seriously, keep doing good. I mean, I love all of your topics and, being powerful.
I appreciate that. Take care.